Hi, everyone. Thank you so much for joining us today for this webinar on health impacts of extreme heat. We're doing this in coordination with the National Heat Safety Week, which is this week, and it's to raise awareness of the impacts that extreme heat has on our health and our communities. So before I introduce our panelists, I'm going to give a quick intro. Um, so let me share my screen. Bear with me. So in today's webinar, we're going to talk about why extreme heat matters now, what the impacts are to our communities, both at the local level and the state level. And we're going to have hopefully some insight on what we can do in these different levels. So, first and foremost, extreme heat is a public health crisis. It's something that we often don't think about unless we're directly impacted. Think of those folks that don't have central air, that are in the middle of a city with no shade, 90-degree heat or more. They have already existing health impacts, and they're dealing with this on top of all of that. It's one of the deadliest weather related hazards. It tops hurricanes and tornadoes. It really is a silent killer. Um, Climate change, of course, is increasing the frequency and severity of heat waves. We see this every summer across Pennsylvania, and it disproportionately impacts vulnerable populations, especially those in urban centers, in already disinvested neighborhoods, and those with already existing health conditions. We're experiencing more dangerous heat events every year, and it's really taking a toll only on people's health but also on their pocketbooks, with the cost of energy rising every year as well. Some impacts: heat exhaustion, heat stroke, respiratory and cardiovascular stress, kidney disease, dehydration. That plays a toll, it puts a toll on your mental health. Increased mortality during prolonged heat events. This is whether you're stuck in your house in the heat, or you're working outside and you're forced to be in a job that requires you to be in the heat with no relief. Again, communities that are most at risk, those vulnerable populations, older adults who likely already have other health outcomes, outdoor workers, such as sanitation workers, landscape workers, children and pregnant people, low income households, and communities with limited tree cover, such as those in our urban areas. This brings an environmental justice concern. A lot of the communities that are dealing with this already have other cumulative impacts that they're dealing with. These communities already have historic disinvestment. Um, Throw in poor housing quality or older housing stock. Pennsylvania has some of the oldest housing stock in the country, so a lot of those houses are not built easily to keep cool in the summer. And then that adds to the energy burden, increased shutoffs. And public health responses must prioritize these frontline communities, but this really impacts all Pennsylvanians, no matter where we live. And there's a historical context here. Older neighborhoods, of course, face the greatest risk, in part because they are older housing stock, but you see redlining and discriminatory housing come into play back from the 1940s to the 60s. A lot of this is still impacting these issues today. A lot of the projects back then removed green spaces, parks, and trees, and we have a lot of highways and interchanges that are adding to the heat island effect. Reduced tree canopy, whether they were removed for utility purposes or they were too costly to maintain. That adds to the temperature. And then, as I mentioned, the aging housing stock. So, we're going to look at what some solutions and policy can do to help alleviate this. And a lot of it is smart planning, and that's at the local level, also what communities can do for each other in terms of public outreach cooling centers, and what policies can local governments and state government put in place to make sure that we're as prepared as possible and as protected as possible. So I'm really excited to have these wonderful speakers here today. Um, Dr. Joniqua Ceasar, who is a primary care internist and pediatrician and is also on the PSR PA board. Alex Skula with the Philadelphia Department of Public Health, and State Rep Elizabeth Fiedler. We're so happy to have you here. And I will hand it over to Joniqua if she is ready.
Sounds good. Let me share my
Perfect.
screen. Thank you for such a great introduction.
Thank you. I will stop sharing.
Alrighty, let me see here. Sorry, one second. Oops. Okay, do you guys see presentation mode or regular mode? Regular, thumbs up, sounds good. Awesome. Alrighty, so as mentioned, I am a primary care physician in Philadelphia, and today I'll be diving into the health impacts of extreme heat, which we've already heard a little bit about, so thank you for that primer. And so, as we're well aware, it's getting really hot. 2024, we had the world's warmest year since we began our record keeping. And, every year we're experiencing this in the form of heat waves, which we are, very familiar with recent days in Philadelphia. And so in our major cities, we're seeing that we're having an increased frequency of heat waves. So the average number in the 1960s was like maybe around two per year. And now we have at least around six or so. And then they're also much longer. So we're dealing with that heat for longer periods of time. And so, compared to prior years, we have like over a month longer of heat waves that we're experiencing each year. And then we know that, with climate change, there are so many extreme weather issues, so many events. But we also know too that when it comes to extreme heat, it is the most deadly. And so when you look at the past 30-year average, we see that heat is significantly higher. So for heat-related fatalities, it was at 158 per year. And that's more than double the next one, or almost double the next one of flooding at 88. And then, of course, you see the other ones like lightning, tornadoes, and hurricanes. And so we know that, like as mentioned, it is indeed a public health emergency. And I think we often think about heat and we think about the more immediate impact, the acute consequences. So, especially thinking about heat exhaustion or heat stroke. And, heat exhaustion being that milder form of it where someone is, feeling unwell, probably needs to kind of relax, place some cool cloths on them, drink some water, but they're still fully conscious. But we're seeing increasing rates of the more extreme one too, like a heat stroke, which can result in coma and death. And so it is, a life-threatening emergency for which someone should call 911. And we're definitely seeing higher rates of both. And just generally, when you think about how this comes to be, when your body exists, typically you want your core temperature to be, like between 97 and 99. And outside of that range is when your body is not able to adequately function. And so you can see with a heat stroke, we're getting like above 100 degrees, above 104 even. And so, when your body is experiencing that extreme heat, it needs to cool down. Normally, you're going to sweat. We all experience that. You get really sweaty. You're losing some of the fluids, some of the electrolytes. That's why people will recommend, drinking like liquid IV or Gatorade or so forth. your system is stressed, and so you're going to be losing that fluid. Your heart is strained. It's pumping faster. It's pumping harder. It's trying to make sure that it's getting blood flow to all of these areas within the body. But when that starts to fail is when you get into, like I mentioned, the concern for coma or death when you're not getting that adequate blood flow, not having the proper temperature for your brain to properly function. And so, you might have like that headache or fatigue or dizziness when it comes to thinking about like more neurological symptoms. You might feel that your heart is working harder. Whenever your body's extremely stressed, there's concern for abnormal heart rhythms because when it's working so hard and so fast. And then with kidneys, we always think about dehydration and kidney issues or kidney failure. You can have, severe injury from dehydration and heat stroke there. And then when you think about the muscles, there's concern for muscle breakdown. And then that can be life-threatening and dangerous as well because your muscles break down and release these different compounds into your body that it's not typically supposed to be there, and that can cause issues with your kidney. And another way that, potentially you could have the kidney failure there. And so we see that it really impacts the entire body, and we think about these different organ systems. And it's very clear when it comes to heat exhaustion and heat stroke. But there are also other ways that we can see heat consequences on the body. And I think it's important, and like Matt started talking about, thinking about who's experiencing heat and how it is unequally experienced. And so, as mentioned, our kiddos who probably don't have the best sweat system as they're still developing, so those younger kiddos are infants who don't have that same reaction when they're younger. Our elderly folks who, like we mentioned, may have, a higher burden of chronic illnesses. And then, especially thinking about our adolescents, we see a lot of heat-related illnesses during the summer months when it comes to athletes in terms of them doing those two-a-days or not staying adequately hydrated, our outdoor workers who may not always have the same protections. And of course, people who are, possibly sleeping outside and sleeping, and we've seen burns related to them just sleeping on the hot concrete from those really hot days. And then, also thinking about the different chronic illnesses. So, like I mentioned, we're really concerned about kidneys. So, what about our patients or our community members who have, end-stage kidney disease? What about those who have high blood pressure and they're taking medications that may, kind of predispose them to being dehydrated? Or those who may have neurological disabilities and may not be able to communicate properly when they're especially hot. How can we make sure that we look out for them? And then also thinking about where people are located. And so we know that, as mentioned, when we look at our historically redlined communities, we know that they have lower rates of green space. We know that they experience the urban heat island effect. So we know that there are areas like Hunting Park within Philadelphia that can feel like 20 degrees hotter on a hot day compared to our other more well-resourced communities. And then thinking about those who have access to protect themselves during the heat, who has properly working cooling support, thinking about our air conditioning, thinking about energy efficient homes, whether someone is renting a home and can afford to make those changes versus someone who doesn't have the same abilities. And I just really want to emphasize too that, we think about, heat stroke, heat exhaustion, but also there's just chronic consequences overall when we think about mental health. And so we've seen that it worsens psychiatric conditions. So this is a recent paper from the Journal of Academic Medicine, and it shows that, with increasing temperatures, we're having increased emergency room visits for mental health. And this is across the spectrum. These are people who have anxiety, depression, substance use, psychotic disorders. There has been evidence that's shown increased rates of self-harm and suicide attempts whenever people are experiencing these severe stressors. And then I think we don't always think about, health and school, but I think even more recently, we saw that, schools went virtual because of the extreme heat. And how does that impact the social determinants of health, thinking about our children, who are in the schools that don't have the properly, energy efficient buildings? They're older schools who don't have access to, proper air conditioning. And there's been a lot of literature that's shown that, you're not able to focus. I'm sure you guys have experienced that on a hot day. You can't do anything, you can't feel comfortable. And so we've seen that there are lower testing scores, especially for math. So this first chart up here, you can see the graph showing that standardized math scores decrease with annual temperature increasing. And we've seen that over the past years. And, the implications down the line when children aren't able to do well in school and then aren't able to, get proper employment and take care of themselves and take care of whatever health conditions they do have or prevent them from happening in the first place, right? And then we see, I think, related to just that restlessness and inability to focus, we've seen increased absences and also disciplinary referrals. And so, even though that's not necessarily, a health outcome, I think it's still really important to think about that in the context of those social determinants of health. And so I say all that to say, as someone has already mentioned, he is very much so a public health emergency. And I think it's really important that we think about those solutions and think about how we can build climate resilient communities for all people, especially thinking about our vulnerable populations. Thank you.
Thank you so much. Now I'll hand it over to Alex.
Hey everyone. Matt, will you be sharing my slides or?
Yes,
Okay,
yes, I
great.
can do that.
Thanks so much. While that's happening, I'll just introduce myself. My name is Alex Skula. I work at the Philadelphia Department of Public Health in the Public Health Preparedness Program within our Division of Disease Control. Dr. Ceasar just gave an excellent presentation explaining why heat is a public health emergency in terms of both health impacts, but also social outcomes and justice as well. So I'm going to talk through how our program collaborates with other city agencies to prepare for, respond to, and build resilience for extreme heat events. You can go to the next slide. All right, so preparedness. Community preparedness is the ability of communities to prepare for, withstand, and recover from public health incidents, both in the short and long term. So our role at the health department is to promote awareness of resources that can help protect community health during disasters like extreme heat events, as well as identify who's most at risk. So one way that we do the former is through community engagement and health education. So our outreach team aims to engage with communities who are at the highest risk of heat-related illness, including older adults, people with chronic health conditions, and people living in neighborhoods with high heat vulnerability, and a lot of the other factors that both other presenters just went over. We use the methods listed on this slide to do that. So we engage with trusted messengers who have a much better and trusted reach with our neighbors and communities than we do, including Philadelphia block captains. We do heat safety webinars throughout the summer. You can see the flyer on this page is highlighting the two that we have the first week of June, one of which is specifically geared toward trusted messengers, and one is for anybody in the general public to attend. We do canvassing in heat vulnerable neighborhoods, both at residences and also businesses and community organizations. We host resource tables, we attend community events. We do tailored trainings at older adult centers and other locations. And we also have a suite of educational materials geared toward specific populations that are available in multiple languages. So all of this engagement typically really focuses on how you can stay safe and cool during extreme heat, what are the signs of heat-related illness, when to get help, and what the priority populations are to look out for. We also always talk through what is a heat health emergency, which I'll get into in a minute, how to stay informed about emergencies, available city resources, and we talk about resources like utility assistance and other benefits to help folks stay cool in their homes and use AC comfortably. And you can always email us at publichealthpreparedness@phila.gov if you want more information about any of these trainings, if you want to inquire about setting up a training for your community, if you'd like us at a community event or meeting, or if you just have any questions about this outreach and engagement or have ideas, we would love to hear from you. Next slide. So in terms of response, the city does have a plan in place to respond to extreme heat events, which is maintained by the city's Office of Emergency Management. According to CDC, these are the 5 qualities of an effective heat response program. So having an early warning system, coordinating with various agencies that have different roles throughout the city, including non-governmental organizations and community-based organizations as well. Having effective public information and outreach, ensuring that response strategies are geared to folks who are most at risk, and regularly evaluating and revising plans based on how the response goes. And I'll walk through a couple of these next. If you want to go to the next slide. All right, so an early warning system. This is how the city makes decisions about when to activate emergency services for extreme heat events. So we actually use our own early warning system, thresholds, and corresponding heat response levels and actions that was developed using local health data. We also use slightly different terminology that's unique to the city to underscore that extreme heat events really impact health and really require action. Whereas terminology, things like heat advisory, heat warning, that might be a little bit more confusing, especially as Philly residents, we deal with hot and humid weather nearly every day in the summer. So again, using that high level language to underscore the importance of the extreme heat event. We also activate responses at lower heat index values in May and June than we do in July and August. And that's because early season events tend to be most dangerous before our bodies start to acclimatize to summer weather. So during a heat caution, which is our lower level activation, which we actually had activated Monday through Wednesday of this week when we had heat index values in the mid 90s. We will notify our heat response agencies and conduct outreach to community partners and high-risk populations. And the Office of Homeless Services will typically also activate their Code Red response to ensure daytime access to cooling and shelter for people who are unhoused. And that response is specifically for people who are unhoused. They'll also do enhanced outreach and water distribution. And then a heat health emergency is probably what you're a little bit more familiar with. This is the higher level, more dangerous event. This is when we activate all of the heat caution services, as well as expanded access to city-run and community-based cooling centers, so people can have extended hours to access air conditioning if they can't do that at home. Those are typically located in libraries and rec centers and are located throughout the city. The Philadelphia Corporation for Aging activates their heat line, and this service staffs their regular helpline with nurses who can help triage people who call in with any potential symptoms, medical issues, et cetera. And we can also possibly deploy mobile teams. You can go to the next slide. An essential strategy of heat response, of course, is effective and accessible public information. Those services I just mentioned aren't very useful if the people who need them don't know about them, right? So these are some of the strategies we use for that for various audiences. Just to give a couple of examples, the Office of Emergency Management does manage a map of available cooling resources, which is available on the city website during extreme heat events. And 311 is available to assist callers with identifying their nearest cooling center as well. We will also issue messaging about events and available resources and activated services to our community response partner network. That's a group of over 1,000 community partners and leaders who receive critical information from us during public health emergencies. If you are already enrolled in that, you should have heard from us multiple times this week, first for the heat caution, but also for the fire that was going on yesterday. So if you are a community organization or leader and want to sign up, we'd love to have you in the network to hear from us. Something else I'd like to highlight is Ready Philadelphia. This is the city's emergency alert system that issues text and email alerts to subscribers when we're getting ready to activate a public health emergency or a heat health emergency. So you can be notified directly. You don't have to go looking for the information. We also have a website called the Extreme Heat Guide. It's really easy, phila.gov/heat. You can find information on heat-related illness, tips to stay cool, and different resilience resources. And you can go to the next slide. One of the characteristics, again, of an effective heat response program is making sure that your strategies focus on people who are most at risk, which I think Dr. Ceasar did a really great job of explaining and highlighting. So an important tool that we use here to do that is our Heat Vulnerability Index. This is a tool that summarizes the most important factors associated with the adverse health effects of extreme heat events to enable us to identify areas of the city that are most at risk, and so we can most equitably distribute and direct resources. So we use this tool to prioritize cooling center locations. Again, there's many of them that the city operates during heat health emergencies, but they are concentrated in these highly vulnerable areas. We also use them to target outreach initiatives. So our canvassing locations, community events, et cetera, recognizing that we always have limited resources, we want to use them most effectively. Other departments have also used this tool to plan heat mitigation projects. So, actually attempting to cool down the neighborhood, which I'll get to on the next slide. And the tool is also publicly available to anybody who wants to take a look using the link in the slide. And you can go to the next one. All right, so addressing extreme heat is really a coordinated effort across the city. There's many partners and agencies that come together to address preparedness, response and resilience, or adaptation. So I wanted to highlight this here to talk through some of the extreme heat efforts from the city's Office of Sustainability. They work to advance heat resilience at multiple scales, ranging from policy development to place-based work in collaboration with communities. So one really great example of that is their place-based heat resilience program in Strawberry Mansion that they've been working on for about a year. So they're working with that neighborhood and their CDC to develop a cool neighborhood plan collaboratively. They're also developing a Be a Buddy program. So they'll establish a network of community leaders who will check in on neighbors during extreme heat and connect them with city resources. They've worked to install a hydration station at Cecil B. Moore Library, and they've worked with the Energy Coordinating Agency to pilot a cool roofs project in that neighborhood as well. I think Dr. Ceasar mentioned Hunting Park also. So this is another neighborhood that comes up high on the heat vulnerability index. OOS has worked with the streets department and some labs from the University of Pennsylvania to test a cool pavement application in the Hunting Park neighborhood. I think they did their second round of that last summer and will be evaluating results soon. You can learn more about that at that link there. And lastly, they worked with, again, the Energy Coordinating Agency to launch a mobile energy center, which expands their existing neighborhood energy centers, which are located at brick and mortar sites throughout the city, by bringing critical energy assistance resources directly to residents through a mobile van. So just like the neighborhood energy centers, this mobile center helps residents with utility grant applications, enrollment, provides energy saving education, and housing stability resources. Next slide. And that's all I have. That's my contact information. Feel free to reach out if you have any questions. And I have the heat guide there as well. Again, happy to provide any of the educational materials I mentioned or talk through training opportunities. Thanks.
Thank you so much. So many great resources there at the local level. So thank you for all of that. And last, I'd like to bring on Rep. Fiedler to talk a little bit about what can be done at the state level.
Hi, everybody. Thank you so much for having me. I'm State Representative Elizabeth Fiedler. I serve in the State House in Pennsylvania and represent House District 184, which is in South Philadelphia. So appreciate the information that we just received. And certainly in particular here in Philly, in an urban environment, temperatures often go even higher. So we know that just earlier this week, it's hard to believe because it's so cool and nice here today, but earlier this week, it really was dangerously hot here. And there's no more perfect time to talk about this issue. So I'm grateful to everybody who put this webinar together. I have a piece of legislation. It is House Bill 1580, and it puts in place protections for workers during extreme heat. So when the heat index goes to 80 or higher, it would trigger these protections going into place. We actually just had a meeting with a bunch of other state reps, and one person said, I think what is correct, why do we have to legislate these common sense things? And we have to legislate these common sense things like making sure workers get rest and water breaks and shade during conditions of extreme heat. Honestly, because not all employers recognize the symptoms and the warning signs, and not all employers are willing to prioritize their workers' health. I think that's really like the easy answer. So I am hoping that we can get this common sense legislation through the House. Again, it's House Bill 1580, and it would require heat-related illness prevention plans in place in workplaces when there is extreme heat. Like I said, when the temperature goes to 80 or higher on the heat index. It would require specifically the rest, water breaks, and access to shade that I mentioned, and training on signs and symptoms of heat illness, as well as training on emergency response procedures if something awful does really happen. We have been working very closely with a lot of organizations on this legislation, which again applies to workers, knowing that extreme heat can hit people in all sorts of places, including at home and at work. We have been working with organized labor, and for example, the AFL-CIO and the steelworkers are strong supporters of this legislation. One of the gentlemen who spoke on a previous virtual event that we had was a steelworker, and he was just talking about how hot it was there. I think he said it went up to, I think, 115 degrees regularly, and they had to, of course, wear all sorts of protective clothing, and had to take breaks to go in to change their clothes to go back to work because it was just so hot that they would get so incredibly sweaty. So just some of the most extreme conditions, obviously, when you're talking about a steel mill, but also we know that folks who do agricultural work, people who work in restaurants, I mean, there are extreme heat situations that can exist in workplaces all over the city of Philadelphia and all over the Commonwealth. This legislation also includes some additional responsibilities and powers for the Secretary of Labor in Pennsylvania. It directs the Secretary of Labor to conduct workplace inspections in case employers are not following the law, and to issue penalties for noncompliance. And those penalties would go back into a fund that funds the inspections. So trying to create a system here where hopefully people will follow the law and will help to protect workers' lives and health. And if they don't, putting in place systems to make sure that they correct that. The last thing that I wanted to mention is, and the previous speakers mentioned it as well, 2024 was the hottest year on record. And obviously we know that with climate change, extreme heat is only going to get worse. A lot of the workers who have told their stories about this bill and related pieces of legislation that we've seen, it is really some of the hardest, most grueling, physically demanding work, no matter the temperatures. And I really think as a Commonwealth, the least we could do is set this kind of floor for protections. This is we see as like the minimal level that human beings should be able to be assured when they're going to work that they will be able to come home. And also knowing that a lot of negotiations happen around contracts for those workers who are part of organized labor, and the organized labor has the ability sometimes to add additional protections on top of it. But we want to make sure that everybody, regardless of whether they're in a union or not, has these basic protections that can save their lives. So yeah, glad for any support. Like I said, we've had great support from both environmental groups and from groups that represent workers and organized labor. And we have a hearing on June 2nd at 10 a.m. in the Labor and Industry Committee. And then also, if folks want to come to Harrisburg on June 2nd at 12:30, we have a press conference as well. But really hoping this is something we can move. And like I said, it's cool today, but we all know, I don't know, I haven't looked at the forecast. Probably in a couple of days, it's going to be back up there in like the upper 90s. So hoping we can get this common sense, but incredibly important legislation across the line. And thank you again for having me.
Yeah, thank you so much. And I think I'll just add that, it is common sense. And I think that the everyday Pennsylvanian just assumes that that's something that's already on the books. So it's obviously not. And it's so important that our workers are protected when they're out in this heat. And so thank you for that. Obviously, if there's anything we could do or anything regarding the bill, we're happy to help get it over the finish line as fast as we can before it reaches the 90s and hundreds again this summer. So I guess I'll open it up to the attendees if there are any questions for any of the panelists. Feel free to either put them in the chat or let us know if you have any questions.
Actually have a question, and I don't know who this would be directed to, but as we all know, the past 2 days we had incredibly high heat. And I know that there were schools that were closed because they could not provide air conditioning for the children. And I know in some parts of Philadelphia, for instance, the libraries are supposed to be cooling centers, but those also aren't available. So we've already talked about this being vulnerable populations. And it seems to me if the school can't protect them and we're just sending them out there, what are the options that we should be offering, or what are things they could do to help protect themselves from the heat?
Whoever wants to jump in.
I can start off. And yeah, I think that's such a valid question. I think, we're keeping them home, but like who knows if their homes even have the adequate protections that they would need during extreme heat, right? And so I think that is a huge problem. Potentially, we don't even really know the burden. But I think that we need to make sure that we do have those infrastructures, like, some of our panelists have spoken on in terms of, where can they go? Is there like a place that the school is recommending that they go to, like their nearest library or whatever it may be? And then I think also just like at a federal point or even state level, just thinking about the programs like the low income home energy assistance program, so that we can make sure if this does happen, if the school doesn't have support, at least the home does through support from these programs that we have seen been, historically underfunded, historically have prioritized warming support or heating support during the winter and not support during the summer times. And so how can we leverage our voice to make sure that's a priority and that the funding is, continuously there? And then I think another point of advocacy would be protections during the summer. And so over 20 states do have protections, utility shutoff protections during extreme heat. So if there has been, the National Weather Service has issued that there is an emergency regarding heat, or there are other mechanisms at play too. Sometimes it's just pure temperature if it's, exceeding a certain threshold. There are a few states that look at just, the summer period. So if it's just like within June or July, utility companies cannot turn off their utilities for these homes. And Pennsylvania doesn't have one and has one for the winter support, but not for summer support. And so I think that's another way that we could potentially, provide other resources for our families during those times.
I'll just add to Dr. Ceasar's last point. PICO and the water department do stop utility shutoffs for people in residential non-payment status during declared heat health emergencies. So that's something that the city has set up. It's not throughout the whole summer, but it's for declared emergencies. We also just issued a health alert this week to share resources about preventing heat-related illnesses and how Philadelphia clinicians can do that with patients who are at risk. And in part of that health alert, we always include how they can help direct folks to utility assistance. And there are some programs that also require medical providers intervention, if somebody has a health risk that would put them at danger if they got one of their utilities shut off too. So that's something else that folks can do and that we do promote.
Seeing something like that at the state level would be so helpful, just to make sure that everyone is protected. And the fact that it's there in the winter in the for the cold, and not for heat, just shows that there's still a disconnect. I think thinking a lot of folks think that, air conditioning is a luxury, but and it is in some regards, but it's more and more necessary every year that we see these heat waves getting hotter and longer. So I don't know if there are any other questions. Um, and if there aren't, if any of the panelists have anything else to add that you might have forgotten. Um, but if there are no more questions and nothing to add, I think we could wrap it up.
And I'll just add one thing from
Sure.
physician perspective. So just like Alex mentioned, don't hesitate to bring those letters or requests to your doctors. Like we're happy to complete those forms. And, it's pretty easy to qualify. If you have asthma or hypertension, whatever it may be, we're always happy to advocate for you. So make sure that you bring those letters so that we can fill them out on your behalf and try to protect you as much as possible during the extreme weather events.
Yeah, that's great for folks to know. Thank you. Anything else? Any last thoughts? Right. Thank you so much to our speakers. Thank you for the work that you're doing. Let us know how we could amplify your work as the summer months go forward, and any other related, health work that you're all doing. But thank you so much for taking the time and for joining us today.
Thank you.
Thank you for organizing.